Disorders of diabetic foot. The topic of discussion in this video. This video help you to understand various food disorder and its cause and care and prevention of food disorders. Let us go into the discussion of the topic. Diabetes may also reduce blood flow to the feet, making it harder to heal an injury or resist infection. The diabetic foot differs from a normal foot in several ways. Changes to the diabetic foot include musculoskeletal, dermatological or skin, vascular, and neurological causes. Because of these changes that occurs due to high blood sugar level may lead to various food problems, and these are common in people with diabetes. This problem can happen over time when high blood sugar damages the nerves and blood vessels in the feet. People with diabetes can develop many different food problems. Even ordinary problems can get worse and lead to serious complications. Because diabetes reduces blood flow to the foot and reduces the resistance to any kind of injury and damage. There are certain common symptoms of food problems which may include and need early recognition so that the food problems can be treated early and major or adverse complications can be avoided. These symptoms and signs are usually the patients complain of burning, tingling, and painful feet, loss of sensation to heat, cold, or touch, loss of hair on the toes, feet, and lower legs, thickening and yellowing of the toenails, onset of red spots, blisters, sores, ulcers, and infected corns or ingrown toenails. These symptoms, when they persist for the long period of time among the diabetic patients, may indicate the patients are developing certain complications which alert the patient and the family members to be cautious about it. Let us move into the various diabetic food problems. The first one is peripheral neuropathy, or we can say peripheral neuropathy of the foot. Neuropathy is uncontrolled diabetics can damage nerves. If these damaged nerves in the legs and feet may not heal, or they may not feel heat, cold, or pain there will be a lack of feeling which will be called as sensory diabetic neuropathy. If the patient doesn't feel a cut or sore on the feet because of neuropathy, the cut could get worse and become infected. The muscles of foot may not work properly because nerves to the muscles are damaged. This could cause foot not align properly and create too much pressure on one part of the foot. Next, peripheral vascular disease. Peripheral vascular disease also due to the diabetes because of reduced flow of blood to the foot. When there is a reduced blood flow or when there is no good blood flow, it takes longer for any sore or cut to heal. Poor blood flow in the arms or leg is called as peripheral vascular disease. If patient have an infection that will not heal because of poor blood flow, that will put them into developing the ulcers or gangrene. Gangrene means death of the tissue due to a lack of blood. The third problem is the athlete's foot. Athlete's foot is a fungus that causes itching, redness, or crackling over the skin. Germs can enter through these cracks in the skin and cause an infection. There are certain medications that can be used to kill the fungus, which could help the patients to come out of this foot problems. This comes in pills or the creams, which should be applied only with the prescription of the doctors. The next foot problem is fungal infection of nails. Nails that are infected with a fungus may become discolored. Either these nails may turn into yellowish brown or opaque, or these nails may come into thick or brittle and may separate from the rest of the nails. In some cases, nails may crumble The dark, moist, and warm environment of shoes can help a fungus grow. An injury to the nail can also lead to a fungal infection. Fungal nail infections are hard to treat because this cannot be treated as easily as other conditions. Medications are available, but that will help only a small number of fungal nail problems, which may require the prescription from the doctors. Sometimes we may have to remove the damaged nail to avoid the further complications. The next condition is calluses or the corns. Calluses, which is a buildup of the hard tissue or skin, usually are the underside of the foot. These calluses are caused by an uneven distribution of weight, and this can also be caused by poorly fitting shoes or by a skin problem. It's normal to have some calluses on foot, so the doctors can decide to remove the calluses if they are troubling the patient. If patient is having a callus, they should take care of it properly. After the bath or shower, they can use a pumice stone to gently remove the built-up tissue, or use the cushioned pads or insoles in the shoes. Medications are available to soften the calluses, but that should be taken only with the prescription of the doctors. But here the patient has to be careful not to remove or cut the calluses with a sharp object. The next kind of disorder, similar like calluses or the corns, again, which is a buildup of the hard skin near the bony areas of the toes or between the toes. These corns may happen because of the pressure from shoes that rub against your toes or which cause friction between the toes when the shoes are used longer period, where there is a worn out part at the footrest of the shoes. So that will direct uneven pressure and may cause this corns development. After the bath or shower, patient may use a pumice stone to gently remove the built up tissue. But again, they should not use any over-the-counter medications to remove the corns or the calluses. And again, they should not use razors or knife to remove or cut this corns or the calluses, which may be a dangerous one when they turn out to be the ulcer or the sores that may again reduce the blood supply, leading into the further complications. Next, diabetic blisters. Blisters can develop when the shoes rub the same spot on the foot. Wearing shoes that do not fit properly or wearing shoes without socks can cause blisters, which can become infected. When treating blisters, it is important not to pop them. The skin covering the blisters helps protect it from infection. They can use the antibacterial cream and clean with and apply the soft bandages to protect the skin and prevent the infection. But it is better to reach the podiatrist or the diabetologist or the skin specialist to treat these blisters. The next kind of complication or the problem that the diabetic patient faces is the bunions. Bunions are the condition where the big toe bends towards the second toe. We can see there is a bony prominence and the big toe is bent towards the second toe. Often there will be a spot where the big toes joints foot become red and the calloused. This area may stick out and become hard. Bunions can form on one or both feet. They may run in the family, but most often they are being caused by wearing high-heeled shoes with narrow toes. These shoes put pressure on the big toe, pushing it towards the second toe. Felt or foam padding may help protect the bunion from irritation. Sometimes doctors also use a device to separate the big and the second toes. If the bunions cause severe pain or deformity, then that has to be corrected by surgery to realign the toes. Next is the dry condition, which is common among all people, but it is further more common among the diabetic patients. Dry skin can crack, which can allow germs to enter. Using the moisturizing soap or lotions help to keep the skin moist and soft. But we have to get the prescription or doctor's advice before using this moisturizer or the lotions. The next condition is the diabetic ulcers. Ulcer is a break in the skin or a deep sore that can become infected. Foot ulcers can happen from minor scrapes, cut that could heal slowly, or from the rubbing of shoes that do not fit well. It is important to treat them as soon as we notice the sores or the ulcers. We can get the doctor's advice how to treat this with the medications and the dressings. Around 10% of people with the diabetes develop the foot ulcers. So diabetic patients have to be very careful. Even a minor cut or any small injuries can develop into the larger sores or the ulcers. Next is the ingrown toenails. This happens when the edges of the nail grow into the skin. They cause pressure and pain along the nail edges. The edge of nail may cut into your skin, causing redness, swelling, pain, drainage, and infection. The most common cause of ingrown toenail is pressure from the shoes. There are other reasons like trimmed nails, crowding of the toes, repeated trauma to the feet from activities like running, walking, or doing aerobics. Keeping the toenails properly trimmed help to prevent the ingrown toenails. When cutting the nails, make sure these people cut the nails straight, not in a curved fashion. If the patient is having a persistent problem or they have a nail infection, they need to consult the doctors. Sometimes they may have to do some procedures to remove the part of the toenail so that the growth plate can treat problems from ingrown toenails. Next is the hammer toes. Hammer toe Hammer toes are the condition where similar like bunion it appears, but here it is quite different. Hammer toe where there is a bend because of the weakened muscles. The weakened muscle makes the tendon in the toe shorter, causing the toe to cut under feet. Hammer toes can run in families. They can also be caused by shoes that are too short. Hammer toes can cause problems in walking and which can lead to blisters, calluses, or sores development. Splints and corrective shoes are available which can be used by the prescription of the doctors. In severe cases, these patients have to undergo the surgery to straighten the toes. And next is the plantar warts. Appearance of warts is a common among human beings, but it is furthermore common among the diabetic patients. Because in diabetic patients, there is a warts which develops on the plantar surface of the foot, which looks like calluses on the ball of the foot or on the heel. They may appear to have small pinholes or tiny black spots in the center. These warts are usually painful and may grow singly or in clusters. Plantar warts are caused by a virus that infects the outer layer of the skin and the soles of the feet. If the patient is not sure of having a plantar wart or calluses, they can approach the doctors to get it diagnosed whether these are the plantar warts or the calluses, and the proper measures to be taken, and they have to remove appropriately only with the consultation of the healthcare professional. These are some of the common conditions that we could see among the diabetic patients. Over time, diabetes can lead to various complications. Many of them are serious if they are not identified at early stage and addressed promptly. Food problems are a common complication in people with diabetes. In general, diabetes-related complication can be lowered by keeping blood sugar in the goal range and seeing doctors for regular checkups. Examining the feet regularly helps to reduce most of these problems. This way, if problems do occur, more likely to notice them right way so diabetics can get the proper treatment. It may take time and effort to build good food habits, but it is an essential part of the diabetes management. These are some of the references made. The pictures used in this video are taken from the Google Images, since this video is used for the educational purposes. Thank you.